And breaking news live at 5, a vote by a CDC committee just marked a significant change. It removes recommendations for using the MMR vaccine on kids under the age of 4.
Atlanta News First reporter Abby Casouras is following the other guidance now under review from the CDC's Shamley campus.
The Advisory Committee on Immunization Practices, better known as ACIP, calls the shots on shots. What vaccinations kids should get, what schools require, and what insurance covers. At Thursday's meeting, members reviewed CDC data on the history of seizures caused by fever after 2-shot MMR vaccines and questioned whether the hepatitis B vaccine is needed at birth. The CDC estimates childhood vaccines have prevented more than 500 million illnesses and over 1 million deaths in the last 3 decades. But if ACIP does not recommend them, the vaccines will not be covered by the federal Vaccines for Children program, even if parents want their kids to get them.
Let me be crystal clear that any change in the current guidelines will cost the lives of children.
There was growing loud criticism of the committee. The American Academy of Pediatrics announced it would no longer participate. The new chair called out 9 former CDC directors by name after they published an op-ed in the New York Times, calling the committee's members unqualified with dangerous and unscientific views.
Currently experiencing heated controversies about vaccines, and a key question is, who can you trust? I suggest that you should only trust scientists that are willing to debate fellow scientists with different views.
The debate comes as Georgia faces falling vaccination rates. Coverage for measles, mumps, and rubella has dropped below herd immunity. Doctors warn even small changes could further erode confidence and trigger outbreaks. Former CDC officials testified this week that Health and Human Services Secretary Kennedy pressured them to roll back vaccine policies without scientific data. Tony Fiore, who spent his career developing vaccines, including the hepatitis B vaccine, called the prospect of a delay a slap in the face.
But I just think they're making a grave mistake.
The committee's vote is merely a suggestion, but CDC directors have almost always accepted those recommendations. On Friday, the meeting continues with a high-stakes vote on COVID-19 vaccines. In Chamblee, I'm Abby Casouras.